From Studio 226 in Orlando, this is Aging Smarter. Aging Smarter is a podcast focusing on making it easier to grow older and to prepare for the future at any age. We aim to educate, entertain, prepare, and amaze you about your life's journey, regardless of your age. I'm your host, retired and former circuit judge, Jose R. Rodriguez. Joining me again is Dr. Sheila Baez-Torres, who is here to help us understand Alzheimer's and other forms of dementia. Also, what gives us hope for the future. This episode of the podcast is called Decoding Dementia, Understanding Alzheimer's and Beyond. Let me tell you a little bit about Dr. Sheila Baez-Torres. She joined K2 medical team as a principal investigator, a neurologist, and a movement disorder specialist with over 12 years of experience in the field. Dr. Baez-Torres' main focus is in neurodegenerative diseases, specifically dementia and Parkinson's. After several years of inpatient and outpatient practice for Advent Health, she joined forces with Compass Research, an independent research facility where she participated as the acting clinical neurologist. She provided supervision to patients that were enrolled in numerous clinical trials within her areas of proficiency. In addition to clinical investigator duties, she also lent her expertise in the referral and the pre-screening process at the site. In 2021, she opened her own successful private practice in Winter Park, Florida, and Dr. Baez's academic background includes a bachelor in general sciences from the University of Puerto Rico, followed by her medical degree at the Universidad Central del Caribe. After graduation, she completed her neurology residency program at Jackson Memorial Hospital at the University of Miami. Then she participated in a 2-year fellowship in movement disorders and electromyography. Most recently, she obtained a master's degree in business administration from the University of Florida in Gainesville. Now, one thing I want to tell you is that Dr. Baez-Torres is bilingual. She's fluent in both English and Spanish, and she has 2 daughters, loving to spend time with her family, and those girls is her passion. And at this point, let me bring Dr. Baez-Torres. Dr. Baez-Torres, good day. How are you today?
Doing great. Thank you for inviting
Did I
me.
miss anything at all about who you are and how you come to us?
You did very good. Thank you.
All right. Well, let's talk about dementia. We hear that word tossed about all the time. What does it mean?
Number one, it's a generic term, right? It means a condition, but there are many types of dementia. So dementia basically means when we are losing certain aspects of our thinking process. And simple words, think about the brain. Each part of the brain has a function. You have areas of the brain that has to do with language, with calculation, with memory, recalling, listening, understanding, vision. So each part of the brain has a function. So you start seeing decline in the baseline level of functioning affecting different areas of the brain.
All right. Well, tell me about Alzheimer's.
So Alzheimer is the most common type of dementia. It's the number one common type of most common type, followed by others, including stroke dementia, vascular dementia, and so many others not as common.
What sets Alzheimer's apart from the other types of dementia?
It's a progressive disease. It's a progressive neurodegenerative disease, right? That means that the areas in the brain that are affected, the brain cells start dying, getting affected, getting inflamed, degenerating. We lose these brain cells. The brain gets smaller. That's what we call atrophy. We can see that in the brain scans. And according with the pattern of the disease progression is how we see the symptoms happening.
So tell me about age. Does age have anything to do with the onset of Alzheimer's?
It's the most common risk factor. Anybody is at risk. From 65 and above, everybody's at risk, but the risk, it gets multiple layers in terms of medical history, uncontrolled diabetes or uncontrolled high blood pressure, uncontrolled high cholesterol puts you at higher risk. Add to that layer genetics, right? That certainly adds family histories. Not everybody that has Alzheimer's has family history, but it adds to the overall risk factor of a patient.
Are we seeing any trends like dementia, the Alzheimer's going up, going down?
Unfortunately, going up, and possibly because we're living longer, right? Possibly because we're getting better at identifying the disease. So it's been diagnosed better versus years ago when everybody was
Nobody
called,
knew.
it's just aging, it's the grandpa is getting
Te estás
old.
poniendo viejo.
Te
You're
estás
getting
poniendo
old.
viejo.
Yeah,
Yes.
there
Now
you
we
go.
understand better and we can identify it earlier.
So, would you happen to know how many people in the U.S. are currently living with dementia, and what kind of trends, other than what we've just talked about?
Yes,
you
close
see?
to, it's getting closer to 10 million in United States alone.
Wow.
Globally, it's over 50 million. And the prognosis is that these numbers are going to double, triple, possibly by 2050.
You know, you just mentioned something that kind of triggered something in my brain, and that is that you mentioned that we were talking about the U.S. and then the world. We have a tendency to think only about the U.S., or at least I do. And when you expand it onto the world stage, holy guacamole, that's a bunch of folks.
That's a bunch of people.
So tell me, do you know whether we are anywhere near clinical trials that might resolve the issue of how to prevent Alzheimer's?
We are getting better and better as we speak. We have studies for disease modification. We're always looking for the cure, but in the meantime, disease modification, slowing down the progression of the disease. There are drugs already approved, and there's so many others under development. We're also getting better with early detection and studies for Alzheimer's prevention.
So
That's
we're
very
talking
helpful.
about right out there somewhere, there are clinical trials that may hold the key to whether or not Alzheimer's is beaten back.
Yes, it's
Wow.
happening. It's impressive, the amount of work, the amount of people involved in this industry looking for the same common goal of curing Alzheimer's.
Let me ask, is there any particular group that is most affected by Alzheimer's?
Yes, Alzheimer's is more common in Hispanics and in Black population,
So minorities.
minorities.
What about women?
Women is also, compared to men, are more commonly affected. That is correct.
Young folks or younger folks, like in their 40s and 50s, that for me is very young. I'll trade. But the younger onset of dementia often surprises folks. What do we need to understand about that younger onset?
Yes, it's a possibility. It's usually genetically driven, and there are many genes that are being studied and identified as risk factors. Specifically, there's one called APOE, the APOE gene that we all have, and we know one version of the gene increases the risk for Alzheimer's. We have two copies of the gene, maternal,
And
paternal. Depending how many copies of that higher risk gene, version of that ApoE gene, we can make a profile of somebody's, how more likely is to develop the disease.
When this was discovered, the APOE
ApoE?
gene, when that was discovered as being a trigger, was it added to the clinical trials that were ongoing at this point anyways?
Yes. Pretty much every clinical trial for Alzheimer's disease include identifying the version of the APOE gene that we have, and they want to know so we can identify the level of risk factor somebody has, the possibility of adverse events, meaning to the medications used in the clinical trial. Does having the specific version of ApoE puts you at risk for adverse events in response to treatment? And how do you respond to the treatment based on that ApoE gene?
So whenever there's a discovery out there that might have something to do with the clinical trial is amended to include that additional research, right?
Every level of clinical research adds the previous level of findings, right? So the protocols, the design of this clinical trial, it's a learning process, improvement process.
How wonderful that is a part of the protocol that, we don't know the public doesn't know that. And that, if nothing else, just gives you more reasons to be proud of what the industry is doing in again, increasing in our knowledge. Caregivers now play such a vital role. What kind of challenges do you think they face day to day?
I always say that it's not easy to be a caregiver, and it's not understood until you live that experience, I have to say, first of all. And I have to commend every caregiver out there. It's a full-time job. It's the responsibility, it's the emotional, physical, financial burden of taking care of somebody with Alzheimer's disease and so many other conditions that affect the entire family. So the caregivers are so important. Taking the patients to the appointments, recognizing the early changes. Sometimes it's the family member who recognizes what's happening before even a diagnosis is made. So we need them. We need them to be educated. We need to support them in every way so we can continue helping their loved ones.
We also talked about a little bit ago about how Alzheimer's and some types of dementia affect populations such as Hispanics, African Americans, and women much more than your general white Anglo-Saxon type male. What do you think is behind those gaps?
It could be our own culture and lack of follow-ups with medical conditions, taking care of whatever medical risk factor we may have, in addition to the underlying genetics.
As a Hispanic, I do not want, I don't want my doctors to listen to me, because one of the things I'm going to say is that sometimes we are terrible about following medical advice. But, it comes to the point where we have to. And we need to, again, as a group, as a society, we need to change, and we need to make sure that we follow what doctors are telling us. Because if nothing else from the clinical trials, that's how we get the kind of earth-shaking, earth-shattering innovation that makes us live longer. So with all these challenges, what gives you hope about the future of dementia care and research?
My hope is in the multiple opportunities of clinical trials available and how better they are every year. Every study I read, I see newer discoveries, newer opportunities of slowing the progression of the disease, always looking for the cure, but certainly modifying this. If I cannot cure it, I want to slow it down. If I cannot give you back the skills that may have been lost with the disease, I want to keep it where you are, right? So you continue enjoying yourself, your life, your relatives. Everybody have common goals. As we plan to get older, we vision each other enjoying family, having independence, right? Being able to take care of ourselves and others, and enjoying family. That goes across nations, across gender or race. And clinical trials fit that hope in my heart.
You know what, Dr. Baez-Torres, I want you to make me a promise, if you can. I want you to promise me that you and K2, whenever you find the cure or anything that would relieve dementia or that leads us to better understanding of dementia and its impact, I want you to promise me that you'll come back to Aging Smarter and tell us about it. Would you do that?
We'll be happy to
Awesome.
share with you and the world.
Awesome. Thank you very much for helping us understand dementia and its impact, your insights, and remind us that awareness, compassion, and research are the keys to aging smarter together. You've been listening to Aging Smarter. Thank you for tuning in. Keep the conversation going. Take care of your brain health and keep aging smarter. Until next time, make sure that you give us a like and that you subscribe. In addition, I want to thank our Emmy-winning showrunner, Art Miles. Also, I want to thank my producer, Annie Rodriguez-Newbern of the firm of Tangle Rodriguez and Associates, who has made this podcast smooth. Thank you.